All right, welcome everybody. Scituate Board of Health, Monday, December 7th, Selectmen's Chambers Town Hall, 6 PM. I will take a motion to open it, accept the agenda.
Make a motion to open the meeting. There's a motion to accept the agenda of Monday, December 7, 2015.
All those in favor?
Aye.
Aye. Okay, item number 1 on our agenda tonight, 19 Kenilworth Street, Title V Septic Hearing System Hearing. Bob Crawford representing the homeowner. And if you could just speak in the mics so everybody knows who you are, Bob, we'd appreciate it.
My name is Robert Crawford. I'm representing the owner, Barry, I forgot his name, Barry O'Brien. Basically, he has a failing system. He's pumping it quite often, and we're planning to replace the existing cesspool.
Okay, can you speak up a little bit, Bob, so people behind you can hear
We're
you?
planning on replacing the existing cesspool with a 1,500-gallon septic tank and 58 feet of our leaching chambers. We're here because we have to request variances to Title V, basically setback variances, relief from the 10-foot requirement of a septic tank to a property line to 7 feet, relief from the requirement of 10 feet to a property line for a soil absorption system of leaching chambers to 4 foot 10.5 inches minimum, and relief from the setback requirement of the leaching chambers to cellar. There's no cellar in this case, it's a crawl space,
space,
to
yeah.
5 feet, 4 feet 6 inches minimum. The other variance we're seeking relief on is relief from the requirement that only one test pit be performed in the area of the system. I guess your requirement is for 2.
Sure, correct. So four variances in total, Jen?
Yes.
1 ABC, and then 2.
Yep. Three for setback distances and
For the 2 pit.
one for the 2 holes.
Basically, it's a very small lot, only 3,600
Yeah,
square feet.
everybody's landlocked, I can see that.
The test hole determination in terms of location and number was made in the field with our Board of Health witness, Ralph Cole, given the constraints and the fact that the property backs up to the dune behind it. They didn't want to impact any conservation-related areas by doing the test hole down there. Bob, correct me if I'm wrong, the plan is, assuming that this plan is approved, is the material where the tank and the field are to be put in place will also be checked to confirm that the material, of course,
Yes, we
is
can
consistent.
dig another test pit at the time of construction. Basically, Humrock in this area, with the exception of Fourth Cliff, is all sand and
Right.
beach stones. We did do actually did the perk test up in the area where the D-box is, in the northeast corner of the lot, and that test pit was down about 4 feet, and that was all sand. We started digging, we're going to dig it out up there, but we're losing the wall that's holding back the dune
Right,
because of the loosened caving material.
right.
And there's all a cement slab all along the right-hand side of the property currently, so that's why we ended up going in front of in the open space in front of the lot.
So reducing from 10 feet to 4 feet, 10 inches, 10.5 inches, huh?
So the maximum distance between the house and the property line is less than 12 feet.
Right.
So accounting for the size of the chambers, and the fact that they have to be a minimum of 10 feet from the existing leaching field. So number 21 Kenilworth has a leaching field with a similar variance granted in the past.
Right.
They had to pull it closer to the house to move it far enough away from that
Right.
existing leaching
Which in
field.
turn gets us closer to the crawl space.
Correct.
Is the system lower than the crawl space? I mean, do we need a
Pretty
rubber
much,
membrane in
the
there?
top of it's right in the area of the floor, yes.
Okay, should we put a rubber membrane in there or keep the,
Well, we can try.
Yeah.
The problem with that is, in the past, the foundations are sometimes not built very well and
Stay
made
away
out of
from it.
block, and, you know, it's liable, we lost one at one time.
Yeah, no, we don't wanna do
Trying
that.
to put a barrier in.
no. All right, no, that's fair enough, because especially too, if the system's low enough, it's gonna
Right.
stay away from it. My only other question was the water line. Is the water line on here?
The
I see.
water service is on there.
Yeah,
I couldn't tell where it went into the house, actually, but I have a note on the plan that it will be accurately located and it's either sleeved or moved.
that's all I was looking for. Perfect. Yeah, we just don't want any contamination, that's all, for the benefit of the homeowner.
Yeah, it's water service.
Yeah, it is what it is. It's a shoehorn, that's what it is. You
It
gotta do what you
is,
can
yeah,
do.
we understand everybody's landlocked in the Hummerock area. Russell knows being living down there. I understand you guys are abutters, is that correct? And what property are you at?
10 Lincoln Street, we're on the north line,
So you're on the.
where the variance is, I think, we're looking for a 3-foot variance there.
So you own the property with the dune on it?
Yes.
Which has no, if I'm correct, in my site visit, I said if I'm correct in my site visit, there's no house, there's no structure on that property, is that correct? Not yet? Okay. So your intention is to potentially build in the future? Okay.
My only question, can
Of course.
Sure, yeah.
my question on that is, rather than get a variance there, it's only 3 feet, why would you go back towards the house 3 feet? Because you're already even closer to the foundation of the house, or the crawl space, the other side, much closer.
Basically, the deck would have to come off, and the owner didn't want to take the deck off the house.
Right. So
You can't put the deck on top of it. You can't take the deck off.
the leaching field needs to be the tank needs to be accessible for pumping
To pump out.
and maintenance as well as inspection. So putting it under the deck would make it difficult, but
What's the distance from the tank to the deck?
I'd say it's about
From the house, it's
Foot and a
14,
half.
yeah, from the house, it's 14 and a half feet. From the house, it's 14 and a half feet, so I'm guessing that space in there is 2
Bob-
feet tops.
Bob's scaling it.
Yeah,
a little less than, a little less than 2.5.
a little less than 2.5, so a little over 2 feet.
I would say, by the way the grading is here, and if you are to develop that lot, that being new construction, you'd have to conform to all of Title V, so this really isn't going to have any impact on your property, none.
We should have more concern of the leaching fields versus the tank, right?
I don't think there's really any concern, because again, you're going to have to meet full Title V because you're new construction, so you're going to be, was it 10 feet from the lot line minimum?
Yeah.
So, yeah, it's really, and it's all pure sand down there. I mean, that stuff's going to whistle right through. So-
Right. Yeah, the tank you don't have to worry about. The leaching field, as you know, is in the front, which, on the side front.
Yeah, this is just one of those things that, we're actually happy to see somebody come in if they know they're having a failed system and they're doing the right thing to fix it. So where the lots are so small, you got to bend any way you can to make it
We
work.
shouldn't have any, I don't think we should have any concern about building in the future.
It won't have any impact. Everything is on their lot, it's just, it's so tight. And like I say, when you go for your permits, because it's new construction, you're going to have to conform to Title V. So your systems aren't going to be on top of each other. I guess that's my point I'm trying to make. Yeah.
It would be 10 feet back.
You'd be 10 feet back with your leaching system, right?
Right.
Yeah, that's a 10,000 square foot lot.
Right, and the way the dune is too, everything's pitched away from your property anyway, so I don't see any, like I say, we're just happy that there's not effluent running out in the ground or anything like that. Somebody's
Yeah, water
taking the
service.
right initiative
No
to
other water service.
fix it.
Actually,
Right.
the
And it's a-
cesspool that's there now is only about 5.5 feet from his property line, so And that is leachate that's going out there, so,
Right.
where the tank is solid.
What the engineer just said was that the existing cesspool is about 5.5 feet from your property right now. So by having the tank where it's being proposed, the equivalent of a leaching area is being moved further away from your property.
That's where the cesspool is now?
Yeah, you can come up and take a look at the plan if you want, yeah.
I've got it here, does it show me on this?
Yeah, it should be, it's kind of a dash circle, just north of that existing deck.
I usually send out a copy of
It's around,
the plan with the
Right.
notice, just so that keeps people away from the meetings.
Roger that.
Well, I mean, a lot of people don't know what's
and
going on.
so that's probably, the engineer said is about 5 feet away. We're going to be 7 feet away.
Yeah.
The tank will be another 1.5 feet
What's
away.
that timber wall? You know what that is?
Probably somebody's retaining wall, because that dune looks pretty big.
Basically,
So
it's like,
it's just holding the dune back a little bit, but
Have you seen it?
it's vertical, like telephone poles that are cut off. They're probably maybe 4 or 5 feet long.
Yeah.
2 feet sticking out of the ground, but they're all rotted out, and we started digging, and they started falling in the hole,
Of
so.
course.
Any questions?
Good? Good. Okay, Bob. Any other concerns? You, Jen?
no, I'm good. I think Bob's explained it perfectly.
Yeah, yeah. And we're all, everybody who lives down there, as you guys know, it's all landlocked and it's tight, and, the variance isn't for new construction, the variance is for a repair, which is obviously in dire need, and they're doing the right thing, so, there you go. All right, I'll take a motion to accept the...
Make a motion to accept the plan with the variances requested of 19 Kenilworth Street.
All those in favor? Aye. Beautiful. Thank you, Bob.
Thank you.
Thank you very much for coming in. All right, next up, item 2 on our agenda for tonight, presentation of Scituate Facts Coalition in conjunction with us, the Board of Health, opiate-related community nursing projects, and Abby Coakley, nurse.
Joining Abby is Anne Marie Dowling, Scituate Facts.
All right.
Moral support.
There's nothing wrong with that.
All right, so my name is Abby Coakley. I'm a nurse at Lawrence Memorial Hospital in Medford and also a student at UMass Boston getting an advanced degree in nursing. And the course I'm in right now is community nursing, which is what led me down to Scituate to be working with Scituate Facts. Scituate Facts is a great coalition. They work to decrease youth drinking and drugs on the South Shore in Scituate. They do educational events, they organize events, substance-free events for the youth, and they do trainings for parents as well. So my project focused on Narcan, and most specifically the new availability of Narcan at pharmacies without needing a prescription, which is new as of 2014. So you could walk into a pharmacy, not have to ask your doctor for a prescription for it, and be able to get Narcan.
I mean, I hate to interrupt, but just for, in case people are watching, just to give a little background about what Narcan is, and why we want to have standing orders and more people to have access to it, probably
Yeah.
helpful.
So Narcan is a drug that you can get that has one use only, which is to just reverse opioid overdoses. So it reverses sedation, hypotension, respiratory distress. Can't be abused in any way. It's only used to reverse overdoses.
I have a question, though. What about the people who are really addicted to this? And I've heard stories about them overdosing, having their buddies give them a Narcan just so they can
Do more.
do more.
So as I did this research, because I ran into a lot of people who were saying exactly that, and it makes sense that you would
Right.
think that's kind of a safety net. The research I found, as far as like the nursing aspects of it, were saying that when you give somebody Narcan, and I've seen this in the hospital, you instantly go into withdrawals, and it's actually like a worse withdrawal than if you just don't have the drug, because it's instant. It's out of your body. It's instant. So the research shows that most people, it's not worth it to them to have that feeling. so that it isn't really a safety net for them.
Okay.
That's what I found anyways.
There were 2 studies
Okay.
published on, does it enable people to use, and there's no evidence that it does.
Okay.
So generally, Narcan is used by a bystander who may or not be an active user themselves. Very often, it's a parent of an adult who's got an opiate problem, or a roommate, or somebody else, because if you are overdosing, you can't save yourself. So it's always a bystander medicine, which is an interesting concept because it's a prescription, which is why Massachusetts is trying to get it out to more people who might witness one. That's why first responders, very widely in Massachusetts now, carry Narcan. Whoever's first on the scene of an overdose, you want to have it. And it's not treatment. It doesn't mean they're going to get better, but they're alive, hopefully, to get better. We have a separate project with Scituate Police to get people into treatment after reversing an overdose, but this medicine is literally for that 3 to 15 minutes where they're going into brain damage and possibly dying. So,
Yeah, so right
it's a
after you
miracle.
give it,
Yeah, it's a
right after you
miracle
give
drug,
it,
yeah.
you have to call 911. They have to, go to a hospital and everything. But it has been proven to be life-saving. So it's a great thing for people to have and for family members to have on hand. So this project specifically right now became of high need because the opiate epidemic has been growing in Massachusetts and really across the country. In 2014, there were 1,256 confirmed opiate-related deaths just in Mass. 5 confirmed opiate-related deaths in Scituate in 2014, and between August 2015 and October 2015, there were 5 in that short amount of time in Scituate. So they think that the reason that the deaths are kind of increasing is that they're cutting the heroin now with fentanyl, which is another drug that is like 50 to 100 times stronger than heroin. So people who've been using take a regular dose and so.
And another reason, just for the viewing audience, very often it's relapse after a period of abstinence. So if you were in treatment or in recovery or in jail for a long time and not using opiates, and you're doing well, and you return to even the previous dose or sometimes any dose, your body can't handle it because your tolerance is gone. So a lot of times, the sad stories are because it's not like alcohol or other drugs. If you make one mistake, it can be fatal. So that's very often the reason somebody has a non-fatal or a fatal overdose. And also we're seeing more and more fentanyl in Massachusetts. So it's risky all the time.
I guess just curiosity, the fentanyl, if it's that much stronger, why do they cut it with heroin? Why wouldn't you just use the fentanyl?
So some people are,
Yeah.
unfortunately, yeah.
Yeah, what's
It
the
used-
fentanyl used for? I mean,
It's
The nurse can explain better, yeah.
Yeah, so it's a pain medication. Usually it's seen for cancer patients, it's a patch. It's like a fentanyl patch you put on the back or whatever. It's really, really strong. But now they're able to make it. They're making it in Mexico, right? And they're making it in powder form. and
So it's
coming over.
illicitly
so this is kind of
produced,
like a
yeah.
hospice drug that,
That's what it
Yeah.
you know,
was.
you're at the end.
Yeah.
it's-
Yeah, that's
with your
right.
peach.
End-of-life care, really
Yep.
strong,
Right.
really highly regulated. So when the police and DEA were starting to see that in confiscated drugs or overdose toxicology reports, this was about a year and a half ago, everyone was really confused because it's so hard to get. It's prescription, hospital only, basically. They were wondering why, and now they figured out from more and more confiscations that it's being manufactured in Mexico in drums illegally and imported here.
Yeah.
Because
So it's just black market, it's black market.
it's
not-
100% black market, not diverted from a medical source, that's right. So it's not FDA-approved fentanyl, it's totally black market, so it's awful. It's a really unfortunate trend.
So with that happening right now, and that, they're able to kind of really pinpoint that fentanyl was the reason things were kind of escalating, this project became even more important for people to know that they could have Narcan on hand. So a little bit background on the standing order Narcan, which is what they call when you can just walk into a pharmacy and not need a prescription. In 2014, Deval Patrick declared a state of public emergency around the opiate epidemic in Massachusetts. And the health commissioner at the time was Cheryl Bartlett, who's a nurse, and she issued an order that said all pharmacists could dispense Narcan, nasal Narcan, which is what we give out, to people who are at risk for overdose and family and friends of people who were at risk for overdose. So Walgreens pharmacies became the first ones to be a part of this initiative in 2014, and then CVS in 2015, just August of 2015, so they're the newest. The doctor who's involved in this, who's kind of the pioneer of like signing these standing orders, is Dr. Alexander Wally, and he's at Boston Medical Center. He signed all the standing orders for the Walgreens stores, but he was, he's a addiction specialist at Boston Medical Center, and if you've ever been around Boston Medical Center, you see, I mean, everywhere around there, you see a lot of people who are dealing with addiction, and he was seeing that and seeing how amazing Narcan was for that. So he said he would sign standing orders for any pharmacy to have Narcan so that people wouldn't have to go to a doctor. It's hard enough to walk into your doctor and say, you know, I need Narcan, or a family member needs it, so to be able to just go in and get it. So he wanted it to be an easy process. So he's really the pioneer behind all of this. My project focused on going into the pharmacies and making sure that they knew about the initiative, and that if we're sending people in there, that they aren't going to get turned away. So even though it was a corporate decision to have this standing order, you know, at a Walgreens corporate level or CVS corporate level, we need to make sure that at the store level, people actually were doing this. So I went to 14 pharmacies on the South Shore and spoke to them directly to make sure that they had standing orders and that they stocked it. Because like I said, we want to make this process easy for people. It's a hard enough thing to deal with. So to go into a pharmacy and ask for it and have them be like, I don't know what you're talking about. So that was kind of where we started, was just right at the pharmacy level. So the first thing I did was I drafted a letter to the pharmacies explaining the project, why we were doing it, and you know who I was and who I was working with. So I hand-delivered it to 14 pharmacies in 6 towns, including Scituate. Out of the 14, 9 had standing orders already, so they were like the chain stores who had it, and 3 were interested in being a part of it. They just didn't have it yet. I asked 3 questions when I went in. I said, like, do you have a standing order, and is it stocked in the store? Are you trained to use it, and do you feel comfortable educating the public on it? So just because they had the drug in the store, I mean, so you get it, and it's a vial, and then it has a nasal adapter. If you saw it, you might not know how to put it together. It's kind of a complicated thing. So the pharmacist has to be trained, but also able to instruct you. Yeah. So the vial comes with written instructions, but you need to have like a 10-minute one-on-one with a pharmacist as well. So we needed to make sure that these pharmacists were comfortable doing that, and if they weren't, that we would help them to feel more comfortable. So that was kind of step 1. Then I went to the insurance companies, which was a little more complicated. I called like 5 or 6 of the major insurance companies just to get cost quotes so that we could also include that, because that would be a big issue for a lot of people too. I kind of got the runaround from a lot of insurance companies about you know, cost, or if it was covered or wasn't covered. It was a little murky to navigate. Yeah. But what we did find out is that most of them covered it to some extent. Mass Health covers it completely. And if you had to walk in and get it out of pocket, it's $19.
Is that single dose?
You get 2 doses.
2 doses.
2-dose
Yeah.
kit, yeah, just like the police would carry.
Yeah.
Yep.
And it's $19. So really, for a life-saving measure, that's not that bad.
Yeah.
So that's what we included in the information. So we took all the data that we gathered from the stores, whether or not they had standing orders, whether they were trained, felt comfortable, whether they needed training, things like that, compiled it into like a 1-page information sheet with the store name, organized it by town, location, and phone number. I also worked with Anne Marie to get the names of peer support groups in the area, Manic Community Health in Hull, just different things that they could go to where they could also get free opiate overdose training and rescue kits. So we included that as well. So we worked with a graphic designer to put that together. This is our...
That's Kara Lieb from Scituate.
Yeah, she did a wonderful job
Yep.
to put that together. She also created another sheet that didn't have the store locations, just had kind of the top information for the pharmacies to display, so they weren't, you know, like, yeah, you know, showing the other stores. And then she created just one that's kind of the top for social media. So that was our sheet.
And now we're going to use that sheet, now that Abby has checked with everybody, or we can talk about the independent pharmacies.
Yes.
But we're going to begin, we've already begun actually today to use that sheet at our meeting. So we had an open coalition this morning at the Fax Coalition office with more than 20 attendees, and we'll use it at all of the support groups in the area, other prevention coalitions, primary care physicians' offices. Yeah, this is something separate, but yeah, of course, yeah.
So that was kind of step 1, just creating the document. Step 2 was making sure that the pharmacies that were a little bit on the fence about their training or feeling comfortable about giving out Narcan because they hadn't done it, making sure that they felt comfortable. So it was mostly like the CVSs because they just started with the initiative. So Walgreens have had them for a year. So the CVSs were great, but they, the communication can be a little murky when a new initiative comes around. So I was able to get in touch with the regional pharmacy manager for all the South Shore CVSs, and she was wonderful. She was actually one of the people who kind of pushed the rollout in Massachusetts for CVS. So she was really on board and was able to make sure that all the store managers were on board. They felt trained, they felt ready if people were coming in. So she was a great resource to have, and she was, wanted to be a part of it. So that was wonderful. We also were able to get in touch with Dr. Wally at BMC during this and share what we were doing with him, which was great. So we also had 3 independent pharmacies that were interested in being a part of this. So the pharmacy in North Scituate was interested, and then they have 2 other stores, one in Hull and one in Hingham. And they were interested in being a part of the standing order. So with Anne Marie and also Barbara Quinlan at Scituate Fax, we were able to organize a training day for them through Manic Community Health in Hull. And the pharmacists got to come in, they got trained in Narcan. There was a doctor there who signed a standing order, and now they can be a part of this initiative as well. So we were able to add 3 more stores to the initiative, which was great.
Awesome.
So that was a great step.
So great.
And then I also visited 3 Rite Aids on the South Shore during this, and just wanted to see what their take was on what was going on, because I knew they didn't have standing orders, and they seemed really interested as well. So I contacted their corporate headquarters on the South Shore, and last I heard they are in talks with Dr. Wally at BMC to get their standing order, so they should be on board, I would think, within the next year, too.
What's your company? Who's the supplier of it?
Of Narcan?
Yeah.
Not sure who.
It's generic.
Yeah.
It's generic, yep. And there's a new, so that's never been the hurdle, you know what I mean? It's just getting people on board with the policy.
Yeah.
Yeah.
It's not expensive.
Yeah.
Even when there's high demand, people were talking about the price going up, but it's still very inexpensive for what it does
Yeah.
compared to
Yeah.
Absolutely.
an EpiPen or an asthma inhaler, it's pretty amazing.
Right.
Yeah.
So, like Anne Marie was saying, we started distributing the flyers, and I did go back to all the pharmacies that were involved in this and showed them. I wrote them another letter, went back and showed them what we created so that they would know that it was being distributed and that they might see some more people coming in, just so they were aware. We had there was a South Shore peer recovery meeting last Thursday. We distributed them there. The fax meeting this morning.
That was a community training.
Yeah, they did a Narcan community training at the South Shore Peer Recovery, and we were able to give these out, and I was able to talk a little bit about the project, so that was good. And Anne Marie sent it to Jason Tracy, who's the chairman of the emergency room at South Shore Hospital, to share with him, and he said he's going to incorporate it into all his discharge paperwork for his patients.
Wow.
Yeah,
Wow.
which is great.
It's amazing.
So it's great information to be out there.
Or well, Walmart pharmacy and supermarket pharmacy.
We're working on them.
I know. We're getting there.
You can see how much work it is to just make sure that the ones that are doing it right. It's substantial, and that's sort of my takeaway from a project like this is there can be lots of great policies at the state level or the federal level or money put towards something, but it requires this community engagement to really make sure they roll out. Because the real impetus for this project was there's a lot of Narcan availability, even here in Scituate. I've hosted 4 community trainings, but people do not know where to get it. They don't know that they can get it for free. They don't know they can get it without a prescription, and that's a dangerous paradigm. So our goal is to really connect the policy with the people that need it. So Abby was able to do it for Scituate and the surrounding towns very well. There's more to do, and I am going to meet with Youth Health Connection at South Shore Hospital to see if more coalitions like FACS I could provide the training for them to go do this. Like, we can't do it for everybody, but we've done it for a good chunk, so I'm very grateful.
So the final step of the project was I created like a how-to manual of the process I went through to do this. So just kind of how I made the connections I made, where I went, kind of step by step what we did, what the letters look like, what our flyer looked like, so that Anne Marie can pass that on to other coalitions if they want to do it in their area as well, to kind of get this going and get more pharmacies on board.
I expect that it'll be a model for all communities, like some of our other projects. And I'm grateful for this opportunity because, it's hard to get all the good work out there, all the good work that's going on in Scituate and other communities. like this can be quiet sometimes, but this is going to make a big impact.
I'm
So
pretty impressed.
it's impressive, isn't it?
I'm pretty impressed.
Oh, good, thank you.
So you decided to do this for school, is that how it?
Yeah, so I was doing a community nursing course, and I grew up in Scituate. My family's still here. So it was nice to be able to give something back to the community, and
Yeah, I'm pretty
this is great.
impressed. It's,
You get a good grade?
Plus, from us. She should, right?
I mean,
Yeah.
it's very thorough,
I
it's
know.
very thorough.
It's-
I'm pretty impressed.
That's
Yeah.
nice.
We received a request from UMass, as well as some other schools in the past, for student placement for these types of projects, and a lot of the students, they go through flu clinics, and Abby and I were talking about kind of the, TB clinics and the day-to-day things. So we reached out to Anne Marie to see if there was some project that we could host a student, through the Board of Health, but, something that could be beneficial to Anne Marie's work, and Anne Marie jumped
on it, and I'm so glad that she was the candidate, because it's been wonderful. And I'm really grateful to the town of Scituate, to Jen and the town administrator for saying yes, because there was a substantial amount of paperwork to accept an intern, and to kind of, not that it's a burden, but to take that on and say that we will make sure make sure she's doing public health work, and that it'll be meaningful, and it certainly was. But we don't have to do that, but it was very nice, once again, for the town to say yes to the prevention work that we're doing, so I'm grateful. It was definitely a win, and a good choice, yeah,
Very,
it's
very
great.
good.
Well,
Yeah.
and hopefully all those numbers go down too.
Exactly.
That's good for
I know,
everyone.
I know.
Yeah.
It's just
I know,
horrible.
it's awful.
Yeah.
But there's a lot of, the numbers would be worse, frankly, if the efforts weren't underway that are stuff like this, and work with the police, and
Right.
and get, and this, I wanted to take the opportunity to remind people about a support group that we have on Sundays now. It's facilitated by Gosnold, which is a great full-service treatment provider based on the Cape. They, because of our good working relationship with them, have donated a facilitator. So they send a professional every Sunday to Scituate. Her name is Holly Carroll, and she's a licensed family interventionist. She's wonderful, and she runs a peer support group. So it's a family meeting. It's friends and family, siblings, spouses, primarily from Scituate, but it's open to the whole South Shore every Sunday at 11. The town donates the space, Gosnold donates the time, and people support each other. So it's people who are suffering from any stage of addiction, any type of substance. It's a wonderful gift that we have here. Narcan is available for free at those meetings as well, free and confidential, Sundays at 11.
Whereabouts is that?
That's at the Scituate Senior Center. At 27 Brook Street, 11 a.m. every Sunday, even holiday weekends. It's a wonderful thing that we have here. I'm very grateful to the partners who have made that happen, because it's really hard. So that's if you're trying to get your loved one into treatment and they're resistant, or they're coming out and you want to know what to do, or you think they need more treatment, which is very common. This is the place to go to kind of navigate that. So that, and the Scituate Police, and wonderful interns like
Yeah,
Abby.
very good.
It's good stuff.
Do you
There's
get a
great
lot of
things.
calls for information on
We-
stuff that's been presented here, or do people come in?
We don't get a lot of calls for this type of information, but I think historically, our office hasn't necessarily been known for this type of information. So the ability to collaborate with Anne Marie, and, we have received some of those
These brochures,
brochures. And I have them outside of our door, and I see that the stack
It's going down,
decreasing.
yeah.
So
That's
I
good, so then we have a place for something.
And then
We
I'll drop
absolutely
these.
do have a
Exactly.
place
And we'll
for
do
this.
probably a Board of Health sent email blast on this project to the town email list. We'll do that in a couple of weeks. I believe the Boston Globe is going to cover this project. I've been warming the door there, because it's a good story. It's about what can communities do when people feel helpless. There are things that we can still
There's a
do.
lot of bigger cities.
What about
Yeah.
the Mariner?
Lindsay talks.
The Mariner's been great. Oh, the Mariner covers everything.
Okay.
Yeah, they put our meeting this morning.
And
Yep.
then the Ledger too, or?
So I'm starting with the Globe, and then I'll get it to everybody else. It just has more reach.
Yeah, of course.
Yeah, but yeah, they're wonderful. This is a project that you guys may not have seen, but as Jen said, the Board of Health has been sharing. We did this last year in our healthcare subcommittee of Scituate Back. So this is a prevention tool, where this is a harm reduction tool. This is when anyone is getting a prescription opiate. So a legitimate prescription, most likely, but a prescription opiate that has risks associated with it. So we have a group of nurses, doctors, surgeons, pharmacists, former district attorneys, people that live in Scituate or work in Scituate or both, who helped us put this together, including Barbara Quinlan, who's a new employee, a part-time employee.
So when you go get a prescription for, say, Percocet or something, they're supposed to give
Well,
you these?
that's funny you say that. So we came up with this because that was not the policy in the state. We came up with this to put all the information in one place in a friendly manner, not scary needles and spoons, but here's some health information for a risky substance you're being prescribed, right? If a kid can be at risk, if you can't drink alcohol with it, you can't take benzodiazepines with it. There's some stuff that gets printed in your little CVS thing that you probably don't read. So we thought would make it pretty and powerful with the buzzword on the front. And then we worked with primary care providers in the area and pharmacists in the area and asked them if they would dispense this. So we've had some people, including South Shore Orthopedics out of South Shore Hospital, who've helped us with a lot of the content. A nurse there, Leslie Stenbeck, who's from Scituate, helped almost write this. So some people were absolutely helping. North Scituate Pharmacy has it at their register. It's harder to get stuff like this into big corporations, but many people have. But anyway, in the meantime, this past October, the state came out with the black and white version of it. So now it's a requirement. I did send it to Secretary Studders at the Executive Office of Health and Human Services, and I'm pretty sure they borrowed some of our content. So theirs is just a black and white, but now, like literally last month, it's a requirement from pharmacies. So my guess is, if I was a betting girl, I would say this will become more of a standard, because people need to have it in that format. Where can I go near me? And maybe where can I go near me that's not my hometown, right? So I'm hoping that will be the case. It's great that South Shore Hospital is going to incorporate it with discharge, and I know, it's awesome. I know.
Wonderful job, guys.
Thank you. Thank you, Jennifer, for letting me do the project. Thank you, Anne Marie. Thank you.
Thank you. Don't leave.
Yeah.
Don't leave.
The more the awareness is better, absolutely.
That's right. So if you guys have ideas I'm happy to come back here if that it's useful.
Sad to say we've all
Yeah.
been touched by it.
I know,
so-
that's the thing.
Especially in a community like this.
I know. I know.
Yeah, it sucks.
And just one other thing from like the CVS and all that, I've been in the corporate world. They change people all the time. New pharmacists and all that.
Absolutely.
Do they keep up on a training thing, so
Yeah.
she doesn't come in as the new pharmacist and know nothing about what's
Right.
going on?
Yeah, so when I connected with that regional pharmacy manager for CVS anyway, she said that they are not allowed to stock Narcan unless the pharmacists are trained. So I would assume that anyone new coming in, they would stay on top of it,
Yeah.
so.
Yeah.
Beautiful.
I'm sure we don't quite have the following that you have. However, we do have our website, we do have our shelf outside, our bulletin board outside.
Awesome.
So if you folks want to provide a little introductory
Like a little summary?
a little
Yeah.
summary, and
And that
if you
PDF?
want to provide this to us, we can get it up
That would
on
be
our
awesome.
website, and then we can also keep these religiously outside of our
Perfect.
door, so that
That'd be
anybody who
awesome.
could comes in,
We'll see it. I mean, it'll be
That's
gone
great.
in a,
Beautiful.
They'll be-
those are disappearing,
I'm glad
so
to hear it. Yeah, good.
I highly suspect that these will be.
Thank you very
That's
much.
wonderful. Thank
Well, the
you.
talk to you.
Great.
Yeah, that's great.
Just to get it out there, yeah.
Fortunately, when things happen, I feel it's better that people are being honest with it,
Right.
as opposed to hiding it.
Right.
Yeah.
And I really feel that that's changing, and we have to,
It's a lot of
Yeah.
talk, and people
Yeah.
aren't ashamed of it,
Right.
I
Yeah.
think, as they used to be.
The-
So-
Yeah.
The stigma is starting to
Yeah.
to
so
go away
that's
a
nice to
little
hear,
bit.
but I think so.
Bad stuff.
Yeah.
Yeah.
Beautiful.
Thank you.
Guys,
Thanks for having us. Thank you.
Congratulations, you did a wonderful job.
Thank you very much.
Yeah, that was.
They all give you A's.
Oh.
Yeah.
Absolutely, absolutely.
A plus, I will too. That's awesome.
Yeah, I give you a lot of credit for that.
Thank
A
you.
lot of legwork, so.
A lot of legwork.
Yeah.
Thank
It's
you.
awesome.
A
Thank
lot
you.
of knocking on people's doors.
I know, it's awesome.
Great.
Thank you very much.
Thank you, guys.
Thank you.
Have a good one.
Abby, thanks so much.
All right. Next up on our, thank you again. Next up on our agenda, introduction to the Scituate Water Resource Conservation Plan. And I'm sorry, and I forgot your name.
So, good evening.
Martha,
Martha
that's
Cook.
right.
I'm a member of the Scituate Water Resources Committee. I realized
Thank you
that
for staying through all that.
it was fascinating. Actually, as you said, it's really important, and this feels sort of
Don't take
trivial.
that.
It's just different.
It's just so important.
Well, guess what? If there's no water, then we don't have to worry about any other.
Well, you're
issues,
there,
so.
that's true. I realized that we had a glitch. This plan is so many pages that we weren't able to get printed copies to everybody. We tried to put it out so that it could be emailed, and it was such a big file that it wouldn't go through people's emails. But you have a copy.
I was able to print it once, and I have to
Great.
tell you, I've tried to print it again, and I've gotten locked out.
Oh,
So I was able to email the link out, but
Right,
haven't
okay.
subsequently been able to print additional hard copies or
Okay.
transfer it to anyone else since.
because I believe John sent to Patricia and you a different way to open it?
Well,
Last month?
yeah, he sent through Google Docs, and I was able to open it once and print out one copy, which of
Okay.
course I have, written notes on.
Okay.
And I sent that link along, but I have since not been able to print or access
Does
it
that mean
again.
none of you have read it? Go ahead, be honest, it's okay.
I think she told me to read 2 specific pages, and I
Right.
know I did, but
Okay.
I'll be honest, that was a month ago, so.
Exactly, it's been a while, we got
Right.
postponed. Well, the good news is, even though it's huge, a lot of it is an appendix, it refers back
So let me-
to
so
our
just
documents
make a
to the
cute little
state.
joke here, we're worried about water, but we're not worried about trees.
Believe me, I didn't print
That's
this.
next meeting, Steve, come on.
We already yelled at him, why is it two-sided? How come
It
it
should
didn't
be
go both ways?
double-sided.
I know, we already yelled at him about that.
Less trees drinking the water,
There
right?
you go.
Less trees drinking the water.
Several of these pages are the report Jim has to fill out, Jim DeBarros, to send to the state to show where we stand, what we're doing, how things have been tested, what kinds of education efforts we're making. So that's a lot of
You
just
already
reporting.
presented to the other boards, correct?
We are, gradually.
So we're
Different
first?
members of my committee are going to different members, so planning and conservation, and everybody's, we all divvied up the responsibilities. I'm not sure where they stand in meeting with everybody else, because we're in the same boat,
Okay,
in that
just
you
curious.
had to postpone, and everybody else, we had to wait to get on their agendas.
I know that one member did present to conservation. That board I know has seen the document and commented
Right,
and is
right.
in dialogue with you folks.
The long-term goal here, which actually is becoming shorter and shorter term, is that our responsibility is to get this in front of the selectmen in a way that they can open and read. And we want all these other boards to simply give some sort of approval. I think John's goal would be to write a basic form letter that says, you've seen it, you understand it, and in general, you approve of it.
With the highlights.
Right. You don't have to approve of all the pages, but in general, if you could, just give your overall improvement. Because obviously, you have the teeth in this matter when it comes to things like enforcement down the road. For some of the suggestions that we're making, we, again, had a great student intern who went through, compared Situate's water to other towns' water policies, looked into what the DEP expects us to do, figured out what we already do well, what we can improve on. And so it goes back and forth in terms that it takes an issue, here's where we stand, here's where we can see improvement, here's what we recommend should happen in the future. But we need the Board of Selectmen to approve all of those things before we can start implementing any kind of changes. We know that, again, we need to do more education in the schools. We want to work with the science departments. We want to help kids understand how to not waste water. We want residents to understand how to, I mean, the least expensive, frankly, free way to reduce the cost of water is to stop using as much water. We get a lot of grief about the expense of the new pipes, replacing the broken old leaky pipes. If you just cut down on how much you use, that doesn't cost anything, and it saves us a lot of money. We are all very concerned. We don't want to end up like California, where we don't have enough water, and we can't tell people you can't build here anymore, but the state gives us an allowance of how much water we're allowed, and we are getting close to the top of our allowance, and we know that there are many building projects already in the works going through the steps.
So is that because, like you said, of leaky pipes, or is that because of new construction? We're getting too close to the top of our limit? Or is it
Both.
just because of overconsumption?
Both, all three. You know, they have goals in terms of how many gallons per person per day. So
Yeah.
in your household, you have.
An
And so,
average, yeah.
so if you build, you know, an 8-bedroom house, you conceivably could be using a lot more water than a
Right.
1-bedroom apartment.
Right.
We don't have any strict strong ability to deter somebody from building. That's obviously got a lot more to do with planning and zoning and everybody else. For instance, I came to talk to you several months ago about just the concept of people digging wells. And we all know about our water restriction in the summer when the usage is the highest, but we're getting the least amount of natural rainfall. So that the reservoir goes down, our wells go down, the stream flow goes down, it impacts local fish populations. One of the things I know your group was working on was well policies.
Right.
We would love to see all well owners abide by the same guidelines for conservation that paid water users abide by. So, like in my district, I'm a Monday waterer. I have to be done watering before 9 a.m. and I can't rewater again until after 5 p.m. If there's a drought and we're all under restrictions of one kind or another, we just think well owners should also abide by those same restrictions. Right now, that's only the policy in a few towns, not ours. We anticipate more wells are going to be dug because more people want in-ground irrigation systems. Those in-ground irrigation systems use more water. One house with a good-sized yard and an irrigation system, even only being used there one day a week that they're allowed to use, uses more water than 10 neighbors combined. It's just the nature of how those systems work. The fact that, for instance, they don't automatically turn off if it rained the night before. They just water anyway. So there are appliances you can get. There are controls, which we address in here. We'd love to see that required. That if you either have an existing system with no rain gauge, we'd like within, say, a reasonable amount of time that you would add a rain gauge. We would like, if you're putting in a new irrigation system, that you do that. And right now, the way the law stands is you can't put in an irrigation system unless you find a different source for water. You can't use drinking water to water your grass. So that if next year I decide I need an irrigation system, I'm either going to dig a well or a cistern or put in a bunch of rain barrels. And so our job is to help just educate people about those choices. But it's going to be a slow process, like she said, about anything new where people think, well, that doesn't matter to me, or it doesn't apply to my town, my neighborhood, my yard. It just takes time. And so to have the Board of Health behind us on this would be useful. So that, once you get to it, is page 17. And there are a couple of other places where it's just in general that water and health clearly go hand in hand. And so we want to support you and hope that you can support us.
So a couple of the specifics are page 15 for under residential water use. One of the recommendations is the adoption of a restriction to regulate the use of town water in favor of private wells or rain barrels for irrigation. So that's not necessarily our jurisdiction, but is a recommendation that would, obviously relate to us.
Right.
And then the one that you're referring to on page 17, since I only print this once and nobody needs to see my chicken scratch. At the time this plan is being finalized, the Scituate Board of Health is developing local regulations regarding private wells. Should the on-site well be developed for lawn irrigation purposes, the Board of Health regulations should require the use of water sensors, what you were just describing, which are in-ground moisture detection units, and use of that system should also be limited to 1 day a week, just as those existing systems on the public water supply. Further, as water commissioners, the Board of Selectmen should require all existing in-ground irrigation systems to install a water sensor, while a reasonable grace period should be offered. This goal should be achieved by spring of 2017. So the whole document covers potential, correct me, they cover potential things that could be done by departments, boards, or committees in a overall approach to lead to collective water conservation.
Exactly.
So this document speaks to zoning and building and planning and health and all of those pieces rolled up.
Many of these other pages that aren't going to be that interesting are, like with the new school building. Clearly, they need to put in water-saving devices, and they will because of building code anyway and plumbing code. And we just want to support that we expect that, and that they could even go beyond that. There are different levels of quality of things like drinking fountains and toilets and sinks where you can purchase the most water conservation option available, which might cost more initially. You know, this faucet's more than that faucet, but this faucet saves 5 gallons more water a day. Well, bump up your expense and buy the better faucet. We know we can't force them to.
You
We
can
hope
fight
they
that
will.
battle.
Exactly.
Asking for more money for.
I know. It's a dream.
Right.
I know. Exactly. It's just, we're looking at
Yeah,
all
but if it's your
the-
cost over time, there's your sales pitch, you know?
Exactly, it does. It saves a lot of money over time. And it's little things like that. It's, do we choose to water a lacrosse field? And if so, should the watering from the lacrosse field be from rain catchment systems instead of drinking water? Because if my kid plays lacrosse, I want them to have drinking water.
I agree, yeah, I
So,
agree.
it's just,
And
it's
in the
lots of little
bathrooms,
ways.
You know, like when you go to some public bathrooms now, you know, you see the sensor, it goes for
Yes.
6 seconds or
Yeah.
8 seconds or whatever.
Right.
And, you know, as opposed to some of these kids in any of the schools will just turn it on and then they'll walk away.
Absolutely,
You
yes.
know, or they don't close it tight enough and it just drip, 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 drip.
Right. And that's a process that we're working on. Again, we attend the Science Spectacular every year. We have an open house at the Water Department. We have information that goes out in the mailings. We really work on trying to not only reaffirm existing common sense, but also to give people more up-to-date information about the latest
What's
things,
available.
what the newest things are.
So what exactly are you asking from us? Is there going to come a point where you're going to have to go before the selectmen?
Yes.
After Jimmy does whatever he needs to do?
We think that we...
And then we put our stamp behind it?
Yes, we would like to get on their agenda sometime 2016. I can't believe I'm saying it's 2016. Sometime in the next few months, we would like to get on their agenda so that
Okay,
they can
so-
review this.
Yeah.
And that they can also then see that it's been to all the other boards and get the board's input to be able to say, yes, this is all great information. We've done a lot of research, and again, the young woman from town who was the intern, thank you, did a lot of research, and we've gone to presentations that have been put on by the state that talk about underground water sources.
So have the selectmen seen any of this?
I don't even think they've seen it yet.
Has
No.
Patricia seen it?
Yes,
And feedback from Patricia?
I haven't heard it yet. I don't know. John might have, I don't
Okay.
know.
Just curious.
Because we've been working on it for a long time.
Yeah, just curious.
Yeah.
Curious.
I don't know. I'll find out. I could ask.
Yeah, well,
Yeah.
I mean, you'd like the support of the town administrator.
Yes.
You know, when,
Yes.
before everybody goes before the
Exactly.
selectmen.
Exactly. Yep.
Okay.
So we were curious about, I know it's been, was it August and September that you were working on your irrigation policies and well information where you were discussing, remember we had...
Life got in the way, and we have not.
Uh-huh.
Well,
we
work
have
work
not.
has gotten in the way, so,
Yeah,
you know.
Life has gotten in the way of work, and
You know,
I know Jen's been in contact with a few of the gentlemen that were here.
Right, the well people. It was
Yeah.
fascinating.
Yeah,
Again, I went home and
right.
did all
They're
sorts of
very
research
good.
and learned
Yeah,
a lot
they're
about wells.
They're
Yeah.
a wealth of proverbial wealth of knowledge, so I know that Jen, you know, I know that she had some contact, and then,
Mhm.
you know, once, whatever changes, probably in the change board right now,
What's
with
that?
the well regulations.
So we had received some initial comments and feedback from the well drillers, you know, subsequent to your comments and feedback. And they were going to provide, you know, well, I should say, I provided that draft to them, and they were gonna provide info, and their thoughts to us, given the ones that, you know, they're the ones that drill the wells. I have not recently reached out to them to see, you know, what specific comments they would have had, like you and
Right.
John, you know, all provided very specific comments and line items, so I still have to get that from them, and then obviously, you know, reconvene with these folks and consider, you know, all of the
Maybe we
parties'
should,
input.
restoke
but-
that fire before it gets too cold. Reach out to them
Mhm.
Yeah.
Yep, no, we.
before they
we-
totally forget.
Yeah, no, it's been on the table, it is on the table, as, you know, as you all know, we're responsible for I think,
Quite a bit.
13 topics within this town, and we're undergoing annual permitting, which is always an extravaganza, to say the least.
Well,
It is high on the priority list. It's just every day that
It's on
we
the
deal
white-
with
it's on the
fires. It's on the
whiteboard.
It's on
whiteboard.
the
But if you
whiteboard.
make the whiteboard, you're in the queue.
Yeah, I usually have notes in my pockets for that same kind of thing. One of the things that they were talking about that night, which I thought seemed in contrast to what I heard at other water events I'd been to, trainings that had people from all sorts of different municipalities, was, they were saying it depends on the depth of the well, and it depends on the slope of the land and everything else, because one reason that point is in this project is that we were learning from all these people who've done research that, in general, the underground water table serves everybody, and regardless of whether it's a town well that we're using to pull it up or it's a private well that we're using to pull it up, that water flows in multiple directions, and from an ethical point of view, if not legal point of view, belongs to everybody. I remember Sean was here, and we were joking, because in one of our meetings with him, he was saying, so it's like we're all drinking from the same big Coke can with a bunch of different straws. And we say, well, that's a pretty fair analogy. And
He likes his Coke.
and the thing was that I got the impression that the well diggers disagreed with that.
Well, because they had informed us, if you recall, that, we did not clarify it totally, that some wells, depending on the depth that I forget if it was an artesian well or the other kind of well, that the well water comes from, the White Mountains, or it's coming from upstate New York, because that's where the water table, because they've gone that far.
At that level,
At
right.
that level.
Right.
So, not to say that's not taking water from, not our local community, but somewhere else, because
Right.
bottom line is, yes, we're all drawing off the same aquifer, no matter
Yes.
what. I mean,
Yeah.
We all live in the same planet.
we're all in the same,
Right.
and we're all on the
Right.
same continent right here,
Right.
so.
Right, which is the bottom
Right.
line of why we were saying that we hope there is a way to persuade homeowners who dig a well strictly for the purpose of watering, that water isn't just theirs, just because it's under their grass, and that water belongs to everybody, and so that if, I'm only allowed to water on Monday, they also should only be able to allow to be watering on Monday. And again, that's going to create, I know, some conflict, because some people don't agree with that. Feel like, well, the air around my house is my air, and the grass around my house is my grass, and the water under my grass is my water. And that's just not what we've been hearing when we go to all these other expert panels, and they're saying, no, this is, all the water is the same, and that just because you dig a well doesn't mean you get to use an infinite amount of water as much as you want, because that is going to have an impact on the people who live around you and the town.
Yeah, I think the well driller said something about an artesian well and groundwater.
Yes.
Where you
Yes.
can suck the groundwater right out of all your neighbors out if you kept pumping it.
Yeah.
But an artesian well is
Right.
deep and, yeah, that's right.
I doubt, and from what I understood, because again, I had to go home and look up a lot of stuff, because the way they were explaining it was in such code, because it was well digger talk. Some of the terms I heard, but some of the terms were more technical, based on what they do every day. It seemed to me that a typical homeowner is not going to spring for the extra expense. And one of the guys was even saying there aren't that many of them around anymore that do the artesian wells, and that it's more expensive, and that.
They said $15,000, $18,000 to.
So my guess is, if I want to dig a well in order to, preserve my prize rose garden, I'm not going to get that. I'm going to get an inexpensive well that I can put in for $5,000 or $6,000.
Well, they're in business too, so they're not gonna forego a job by saying that you have to,
Right.
dig this well, it's gonna cost you 5 times as much as
Right.
the other well is, so it's a fine line there, you know what I mean?
Yes.
That you
Yes.
can't take the food off of their table. But
Right.
believe me, I'm all for it, I understand what you're trying to
Right,
do.
well, and again, I feel like while I trust them, because obviously they know what they're talking about, they have a vested interest in allowing people to keep digging wells.
Right.
Whereas the people from UMass and the people from MIT and the people from DEP that we were hearing at these other conferences are just wanting to make sure we all meet our water withdrawal guidelines that have been set by the state, and that we preserve enough water for the future, and so that we have enough for safety and enough for drinking and health. So it was, again, I'm sort of stuck in the middle because I'm very neutral about this, and so I'm hearing from the experts saying, you can't let people dig wells, and I'm hearing from these guys saying, the wells we dig are well done. Safe,
And I'm sure
I'm
they-
sure no
clear.
matter what decision's made, somebody's going to get
Of course.
ticked off.
Of course,
Right, it
yes.
doesn't, right, there's gonna be a case to be made for both sides.
But
Absolutely.
I think we did all agree that if there was a water emergency, that nobody would be watering.
Right.
Bottom line, no matter what,
Right.
it's an emergency.
Right, and,
There's no argument there. I don't think anybody would argue that.
right, and I guess it's the definition of a water emergency that becomes
It's the town.
a concern.
The town does it, yeah.
Because, again, Jim has the authority to say, look, we haven't had enough rain, the reservoir has dropped to a level that is dangerous, and there isn't going to be more watering, period. And it upsets residents when you've got the person across the street
Oh,
with this
yeah.
lush green yard because they're using a well.
Oh, yeah.
And so we just think for the good of everybody being able to get along with everybody, it would be better if we were on a just playing even field that everybody abided by the same rules. So,
Beautiful.
that's our hope.
Yeah.
I will see what I can do about getting you other copies, if that would help, just so that you can
Yeah,
all
or
mark them up.
if there's an update to the link that we
Okay.
can get it open.
I'll mention that, and I will try and make sure your copies are printed double-sided.
Great.
Any questions, anything?
No, Martha, that was good.
Okay,
We
great.
will,
And I know you need time, and I
yeah,
can come
we'll
back
move
at
it, yeah,
some
we'll
point.
move it forward. We'll
Okay,
move it
all right,
forward.
all right.
Now, I have a series of, because I can't help myself when it comes to QC and review, it's just a little tick I have.
That's quite all right, quite all right.
So I don't know.
I'm a
if-
grammar, maths, and
Oh, okay, so-
I've yelled
so-
at John about a lot of this stuff.
Okay, so being a fellow grammar Nazi,
Yes.
I had some random little review comments for consistency throughout the document,
We
like
would love to hear
acronym
that.
usage and that
Yes.
kind of thing.
We would love to hear that.
So if
You know, sometimes when you're too close to a project, you don't, sometimes when you're too close to a project, you just don't see that. And if it's the 10th and 12th time you've looked at it, I think, okay, yeah,
It
that
helps
seems
to
good.
have fresh eyes.
It does, definitely.
So I didn't know, I was doing
Right.
it for my own benefit, but if
Right.
it's something that can be helpful, I'm happy to pass along,
I think one
you
of
know,
the
this to you.
regulations we were working on.
Same
We
thing.
went through that, it was, one place is called a house, a dwelling, an abode.
Yeah,
They
yeah.
say, just make it a house or whatever.
Right.
Define
Right.
it, pick one.
Pick one
Right,
and use it.
yes.
Start
Yeah, we
multiplying that,
don't
make
exactly have a
confusion.
style guide for our things, and when the three of us look it over, we'll say, oh, that doesn't make sense, you can't say that, and so ours are marked up with red print too. So, yes, actually, that would be very
Okay,
helpful.
yeah, pass it
not-
along for
Because this is not
consistency, what I've seen.
final, this is, you know, draft, I don't know, 10 of many, but no, there's still room for more improvements and changes, and so we appreciate the feedback.
And I have to say, if your student kind of put this together and really did formatting it,
Yep.
like we praised our student, your
Right,
student
right.
has done a fantastic job
Right.
compiling and organizing
Yes.
and making it readable
Yes.
so that you can follow one topic to the next.
Right, well,
She
yeah.
did a lovely job, and I'm not
More town-
related.
More town documents. I think some of our things that go out are not terribly reader-friendly.
Yeah, she did. She's done a really great job.
Super, thank you very much.
Martha, thank you again. Nice to see you as
Let me know if there's anything you
always.
need from our
Thank
committee.
you. Appreciate
We're
it.
not meeting in December, but we can get back to you
I
if
can
you need.
email
Yeah.
you these kinds of things.
Okay.
Okay. Thank you. Thanks, Martha.
Okay, next up on our agenda, administrative invoice approvals. We're taking care of the invoice approvals now. Jen, is there anything else you'd like to add? Administrative? You've kept us up to date with everything that's going on?
We are in the process of our annual permitting. I think I called it an extravaganza. We have approximately 90 food establishments that we are in the process of reviewing their applications, corresponding with them about various needs and omissions in their application, or, we've already signed off on their permits if they're good. We're doing the same thing for septic pump and haul, installers, inspectors, tobacco permits. And fog, yep, that's part of the review process for the food.
All right.
So I think we'll be working with some folks, some of the smaller folks that don't have grease traps as of yet. will likely see some of them in here soon. But the fog, reviewing all the fog paperwork, we sent out a questionnaire to everybody in October, end of October. We received the questionnaires back from everyone, so we're incorporating review of those into their application process. So that's really the biggest thing that we're working on right now is trying to get through all the annual permits.
Okay. Beautiful. All right, anything else?
There's something, I don't know, there's one here and then there's one here that's a photocopy, so $43.
All right, I guess I will take a motion to adjourn the meeting.
Motion to adjourn.
All right, all those in favor? Meeting's over.